So there's over 14.5 million cancer survivors in the United States, and these patients often have a long and prognosis and want to know more about what they should be doing to reduce their risk of cancer recurrence. So the guidelines are for you to achieve and maintain a healthy body weight, engage in regular physical activity, and eat a dietary pattern rich in vegetables, fruits, and whole grains. And so we're looked at whether patients who adhere to those guidelines actually live longer. And so we found this was in colon cancer specifically, and so patients who adhered to the guidelines had a 40% lower risk of death than those who did not. So I think it's really important to spend time counseling patients and doing the best you can to help them both learn about the guidelines and maybe refer to dietitians or exercise counseling or therapists who can help people adopt and maintain these behaviors and for the long term of their survivorship period. Yeah, so our data really suggests there's a lot that individuals can do to improve their prognosis. So, both engaging in regular exercise, so ideally at least 30 minutes a day, 5 days a week of just walking is enough. And in your diet, choosing whole grains over refined grains, and really aiming for at least 5 servings a day of vegetables, ideally a variety of vegetables. Those were the key things that patients in our study were doing, and those that did them did better. And it's really something everyone can do. So the American Cancer Society actually has a very nice website that lays out these recommendations and some of the evidence behind it, and I definitely say that's a good starting place. And then I think beyond that, I think a lot of teams are trying to develop tools and resources that will hopefully in the future become more widely available, like apps and things like that can help specifically cancer survivors adopt healthy lifestyle behaviors.